Chronic obstructive pulmonary disease, or COPD. What is it? Chronic obstructive pulmonary disease is a group of long-term lung conditions. Diseases can include refractory asthma, bronchitis, and emphysema, which are usually the most persistent in people. Bronchitis and emphysema can sometimes even occur together, making it difficult to empty air out of the lungs due to the narrowed airways. Patient X. Our patient was retired 80-year-old female suffering from COPD. She had started with a cough 10 years ago, which soon turned uncontrollable. However, her cough suddenly disappeared without any reason, but then developed into chronic bronchitis in 2014. When it was diagnosed, she now lives with COPD, and her routine helps her remember what medication she needs to take. Her condition was at its worst when she was coughing uncontrollably due to the fact it constantly tired her out and left her breathless. Simple tasks such as tying her hair up were hard for her, as she had no energy to do so due to the constant coughing. She also could not speak without breaking into a fit of coughs. Chronic bronchitis. Bronchi tubes are the tubes in which the air goes through to get to the lungs. If these become inflamed, the tubes become narrow, making it more difficult for the air to get through. This will result with difficulty in breathing as the air cannot get into the lungs. This disease is known as bronchitis and can be split into acute or chronic. Acute can be cured via medication such as aspirin and fluids, and is usually gone within a couple of days or weeks. Chronic, however, is usually a long-term disease and will usually be part of the person's lifestyle. Chronic bronchitis falls under COPD. This is what our patient has. Chronic bronchitis. Inflammation of the bronchial tubes can cause a buildup of mucus. This can result in a cough and shortness of breath where mucus phlegm is usually coughed up. If this cough lasts for more than 3 months, it is no longer acute bronchitis but chronic bronchitis. This is usually caused by inhaling harmful substances, usually by smoking or air pollution. Other conditions under the COPD. Emphysema. This lung condition is when the air sacs at the end of the airways in your lungs become damaged with holes. These holes can trap air in the lungs, making it harder to move air in and out. They also lose the elasticity and become baggy, resulting in a loss of their efficiency. These air sacs are called alveoli, and any damage to them are usually irreversible. Refractory asthma. This is a specific type of asthma that does not improve when using the standard treatment and therapy. For example, salbutamol inhalers. Due to this, people who have severe asthma have persistent symptoms, such as frequent asthma attacks. These symptoms are therefore more difficult to control than regular asthma. Diagnosis of COPD. There are different ways that COPD can be diagnosed. One way is by a test called spirometry, which is a test that can show how well your lungs are working. You would be instructed to breathe into a machine called a spirometer after inhaling medicine that helps to widen your airways. Another test that may be done to diagnose COPD is a chest x-ray, which helps to look for problems in the lungs. Sometimes further tests are done to find out the severity of the COPD in the patient. Our patient was diagnosed with COPD in 2014 after a long persistent cough. She had developed breast cancer 15 years ago, but is now currently cancer-free. COPD has developed after her cancer. Treatment. Oxygen. Your healthcare team can recommend a specialist to see if oxygen may be of help to you. People who have low oxygen levels are usually the ones that have this type of treatment recommended to them. Oxygen is not a treatment for breathlessness, which is usually a symptom of COPD. Lung volume reduction surgery. Various people with emphysema may benefit from surgery to remove parts of the lungs that have been severely affected. This can result with the lungs working better as only the healthy parts remain, non-invasive ventilation. This type of treatment is most likely to be offered if you are admitted into hospital due to severe flare-up. This treatment involves wearing a nasal cannula where a soft tube is inserted into your nose, or you can also have the option to wear a face mask, which is connected to a machine that pushes air into your lungs. Lung transplant. People with severe COPD that have not gotten better with treatment might be a candidate for a lung transplant. This can be depending on your age, any other illnesses, and what your results with other tests would be. This is usually a last resort as lung transplant is a high-risk operation. Due to this risk, only a small number of people are suitable for it. Suitable organ donors are also very small in number. Living with COPD and self-care. Taking your medication regularly and when you are supposed to is one way to better manage your COPD. This would help to prevent a flare-up of your condition. It would also be good to read the information leaflet that comes with your medicine. This can give you information about what other medications you should avoid, such as paracetamol. These medications might interact with your medicine and cause a flare-up. Other ways include exercising regularly or joining clubs or societies in your community to help your physical and mental health. This can also contribute in maintaining a healthy weight. When you are active, try out some breathing exercises and techniques for when you feel breathless. If you have any questions or concerns about your medication, it would be advised that you talk to your care team to help you with any inquiries that you have. They are happy to help so you can get the best care. Living with COPD and self-care. Quitting smoking, if you smoke, is also helpful, as it would slow down or prevent further damage to your lungs. Watch what you breathe, as some things like dust can cause flare-ups. Try and stay away from sooty particles like car exhaust and people who smoke. Vaccinations can be administered to help lower your risk of infections, as people with COPD are more vulnerable and susceptible to illness. Watch the weather as well, especially for the cold or periods of hot weather and humidity. Remembering your regular checkups can also help your health and maintain well-being, as you can ask your care team any questions or voice your concerns about side effects or anything else that is worrying you. Patient X's life. Our patient lives by herself, but has her family nearby and can take care of her if she requires it. She had also informed us that she would rather visit her family than them visiting her as a precaution. If she is sick, she would not like to get her family ill, and vice versa, hence why she visits them, and not the other way around. She finds it easier and more convenient that way. She had informed us that she also prefers going to a private GP if she has a problem with her health rather than the NHS, as it is dealt quickly and with no fuss. She does not mind the extra payment, as she thinks it is worth the money she pays. The only time she goes local is only when she picks up a prescription from a nearby pharmacy. Patient X's life. She was also constantly cold and could never get warm. Along with a thick coat / jacket, whenever she had to go outside in order to warm and protect her from the weather, she also only travelled when necessary and stayed indoors if the weather was particularly bad. In her routine, she takes a medication and vitamins in the morning right after another, so she does not forget. She has said that she does not experience any type of side effects with her medication, and she receives plenty of support from her healthcare team. They have provided a pill box for her, allowing her to easily access her medications. This has also made it easier for her to remember what she requires on the day. She said it works for her, it is convenient, and it is easy. She has said that she will continue doing it for the rest of her life and is far happy with her lifestyle. Further help. Living with a condition does not have to be handled alone. There are support groups that can make things easier, where you can meet people who have the same condition as you or experiencing similar things. The British Lung Foundation Breathe Easy support groups. This support group allows you to find support in your local area. It allows you to make new friends, which you can meet regularly. You can listen to stories or tell your own. Helpful note. This is part of the British Lung Foundation. This includes a forum/chat room where you can post anything and members can reply or start a conversation. This can be helpful when interacting with your friends.